Hello there, everybody. Welcome back again. DangTeach at CCSD, the second parter on common drugs and their usage. So last time we covered chemical name, brand name, generic name, how drugs are classified, and we got into our first drug class, which was analgesics, the painkillers. If you're new to this channel, welcome to the community. And if you're back again, thanks for joining. For today's lecture, we're going to cover anesthetics, anti-infectives, and antineoplastic agents, or cancer meds. All right, and anesthetic agents. So pain is only one sensation. So here, anesthetics are going to prevent all sensation, pressure, pain, heat. You won't be able to know which orientation your arms or legs are in when you get an anesthetic. Two types of action with anesthetics. We have the local action. So it's going to block pain without causing unconsciousness. So you won't lose your consciousness. It's going to probably just anesthetize or numb the area you apply the local anesthetic. An example would be an epidural. You don't go under, but you just lose feeling and control of your lower extremities. Conversely, we have general anesthetics, which will put you unconscious. So when they used to do surgeries at the barber shop, they'll just give you some ethyl ether or chloroform to inhale, and you'll go unconscious. They'll do their cutting, and they'll just wait to wake you up. Local anesthetic. Cocaine was probably the first real good local anesthetic. Before that, any surgery required that ethyl ether, or the chloroform. It's used dental work, so that big old long needle that they put in your mandible targets the nerve and prevents the pain signal from getting to your brain. Same with an epidural, so around your lower back, no other signal will travel from that point on to your brain. So if it never reaches the brain, you never perceive the pain. Right? So as long as you block that message from getting into the central nervous system, you'll never feel the pain. So if you never feel the pain, does it even exist? So you guys probably heard of phantom limb pain, where an amputee will still have pain, feeling, sensation as if they still had that limb. So if there is no arm, why is there pain still in the brain? Next is general anesthetics. So they come in many forms. It could be IV or inhalation form. So I mentioned the ethyl ether and chloroform. That's not well controlled. The stuff we use nowadays in the hospital is going to be way better controlled. So stages of anesthetic. So here, general anesthesia. First, we want to give you enough that you can't feel pain, so analgesic effect. And then what we're going to do is we're going to step on the brake pedal. So remember, the parasympathetic nervous system rests and digests. So if we stimulate rest and digest, it's like stepping on the brake pedal, activating the brake pedal and slowing the person down further. Where we want you to be is at surgical anesthesia. So there's no pain, no sensation at all. However, we do not want to give you too much where we start to pretty much shut down your diaphragm. So the signal from your brain going to the diaphragm, having you breathe, once we give you too much and that's blocked, then you may die. Next class of drugs, anti-infectives. So when you're infected with a single cell organism, that's an infection. If you're infected with a multicellular organism like a worm, then that will be an infestation. So bacteria you guys are familiar with. Worms, viruses, fungi. So yeast, mushrooms, but protozoan, probably new to you guys. So protozoans are kind of in between animals and plants. Common protist that causes disease is malaria. So malaria is not a bacteria, a fungus, or a virus, or a worm. It's a protozoan, a different kingdom of life. So we have antibiotics, usually against bacteria, antivirals against viruses, and antifungals against fungus. So you have to use the specific treatment for your type of infection. So what type of organisms do we have vaccines for? So the flu vaccine. What type of organism is the flu? So the flu is a virus. And we also have tetanus, right? Tetanus is a bacteria. So those are it, only virus and bacteria. We do not have any vaccine protection from fungus, so yeast infection, ringworm, athlete's foot, or malaria at this time, being a protist. Antibiotics. So antibiotics action to kill bacteria. So bacteria cell structure is a little bit different. They don't have a nucleus, but they have a cell wall structure that's very different from anything else. It's made out of a peptidoglycan structure, so a sugar protein molecule. So antibiotics will disrupt that cell wall, and that'll allow water to rush in and kill the cell. Protein synthesis. So enzyme production and growth. If the bacterial cell cannot make enzymes, then it can't do any metabolic reactions. Next, DNA synthesis. If you can't make DNA, then you can't divide. And another way antibiotics work is to prevent the production of folic acid. So enzymes are like the workers in the body. And what the enzymes need are the tools to work. And the tools for enzymes are vitamins and minerals. So folic acid is a B vitamin. Bacteria cannot absorb it from the environment. They must make it on their own. So if they can't make it, it's going to be real hard for them to regulate their energy consumption. For us, we can absorb it from our diet. Antibiotics are either bacteriostatic or bactericidal. So bactericidal would be antibiotics that affect cell wall. They'll poke holes in the bacteria and pretty much lyse them and kill them. Whereas bacteriostatic will inhibit the growth and expansion for your body's natural immune system to fight them off. Superbugs. Yeah, so superbugs are resistant to our antibiotics. So in the microbial world, it's just chemical warfare. Viruses. So viruses, really small. They can't self-replicate, so they have to infect a host cell, hijack its manufacturing mechanism to make new virus particles, and then release those particles to infect new cells. So to treat or to prevent the spread of viruses, you're going to block one of those actions. So if you have a virus, it's going to need to identify this host cell. So that's number one. If you're able to block attachment and prevent the virus from detecting its host cell, then you'll never get infected. Next step is once a virus attaches to the host cell, it needs to inject its DNA into the cell and start copying the DNA. So if you block the DNA replication, then it can't make new virus particles. If that fails and virus parts are made, so here's some capsules, some DNA, some legs, you can block the assembly of these virus parts. So the virus, in order to be viable, needs to be put together after the parts are made in order to infect new cells. So even if the virus particles are able to assemble, we can still prevent the spread of the virus infection if we never allow for the new virus particles to escape and spread. So that's our strategy for dealing with viruses, because once you get a viral infection, you'll have it forever. Viruses versus retrovirus. So HIV is a retrovirus, meaning that the viral DNA is inserted into your healthy DNA. So you don't even need virus particles. As long as that DNA is copied again and again, the viral information is within your cells. In this case, for HIV, the T cells. If you take a look at Magic Johnson's blood under the microscope, you will not find any virus particles. He has undetectable HIV. However, if he stops taking his meds, all of his retroviral medication, then the DNA will begin to express, making parts, then assembling those parts, and if they release, then they'll attack other T cells and can lead to AIDS. And AIDS is when your T cell count falls below 200. That's AIDS. Why are HIV patients on multiple drugs? Well, we're trying to block either assembly, DNA replication, assembly, or release. However, since viruses mutate so quickly, it's really hard for us to stay one step ahead. So you'll get a combination, and then next month they'll mix up the cocktail. Antifungals. So we do not have vaccines for fungal infection. So ringworm is not a worm. It's actually the decomposing action of fungus. So fungus will only eat dead skin. So once it eats dead skin, it has to move out and eat the next layer of dead skin. So that's why you have the ring pattern with ringworm. Candidiasis is yeast, and Astley foot is tinea. So anytime you see tinea, tinea pedis, that's for the feet, tinea capitis on your head, tinea corpus on your body. Do we have vaccines against fungal infection? No, we don't. But one recommendation is if you go to the gym, your kid wrestles, is you use a soap that helps your body's normal flora, the healthy bacteria in your body. You don't want to use an antimicrobial soap that strips your body of the healthy bacteria. You want to use a soap that actually helps them out. That way they can fight things like staph and MRSA. Antineoplastic, cancer med. So a tumor is just irregular growth, and it's usually localized and hasn't invaded nearby tissue. Whereas cancer is going to be more aggressive. When it's malignant, that means it's able to metastasize. That means travel throughout the body and colonize other parts of the body. The normal cell cycle. So mitosis is the process of cell division. Most cells are not under cell division. But before you even enter cell division, you got to ask yourself, is it a good time to divide? Is there enough nutrients? Am I healthy enough? Do I have enough energy? So that's the first checkpoint that the cell will go under. So let's just call that checkpoint 1. Is everything okay? And the cell also goes through another checkpoint after the DNA is copied. So here we have the DNA already copied. But before I start dividing into 2 cells, I got to check, is that DNA good? So we'll call that checkpoint 2. So here, interphase, we're just growing until we get the clue that we may need to divide. So we go through checkpoint 1, making sure we have enough energy, enough supplies and resources. So we go ahead and copy the DNA. So we copy our DNA, and then once we copy our DNA, we got to do one more checkpoint before, oh, that's supposed to be good. One more checkpoint before we enter mitosis. And mitosis, this second checkpoint, is really just checking if the DNA is okay. Now with cancer cells, they really don't care about these checkpoints, whether there's enough supplies, resources, energy. Cells will just copy its DNA. And then whether if the DNA is good or bad, cancer cells will just continue to divide. Antineoplastic. So they're going to be against new formation of cells. So cancer cells divide quickly, but you also have healthy cells that need to divide quickly. So hair and skin rapidly divide. Now they no longer replace any lost skin, and your hair starts to fall out. GI tract. Some of the cells lining your GI tract only live for 3 days. So they are actually constantly turning over. And now they're not being replaced. So you have a lot of GI problems. And in your bone marrow, that's where blood cells are formed. So the cancer med doesn't only affect the cancer, but it also affects your healthy cells at all. So you'll be anemic. They used to give cancer meds back to back, and the survival rate wasn't that great. So now we give a round of chemo meds, allow the patient to recover, but the cancer also might recover a little bit. But then we'll give them a second round, a third round, fourth round until the cancer is gone. So the strategy is our healthy cells are able to recover faster than the cancerous tumor. Types of antineoplastic agents and their action. So the first one are antimetabolites. So you can think of a DNA chain just like Legos. You stick one Lego to the next piece to the next piece. But you have a Lego piece that's kind of shaped weird, like this one, then the next building block can't attach. So you can't finish copying that DNA chain, so you can't really replicate. So those are the antimetabolites. Alkylating agents. So these were used in World War I for chemical warfare. So the mustard gas. So alkylating means to bind. So what these agents will do is they'll bind to DNA subunits and prevent you from growing the chain, growing that DNA chain. Plant alkaloids. So from the rainforest, they're able to found an alkaloid. So it's similar to a base compound that affects topoisomerase. So this is a fancy word, but DNA, to replicate DNA, you need single-stranded DNA. So normally DNA is double-stranded, and you can't get to the single strand to copy it. What this enzyme does is it kind of unravels DNA, creates a little bubble, and it allows for the single strand DNA where we can then copy. So these plant alkaloids prevent the enzyme from exposing single cell DNA, and then you can't copy it if it's not single strand. Hormones. So hormones affect the environment, and they directly regulate gene expression. So normally hormones are used with reproductive tract cancers. So if you have too much male hormones, too much growth of the male genitalia, then we'll need to balance that with maybe some female hormones. And conversely, same thing with female reproductive tract. They'll use male hormones to suppress growth caused by estrogens. Antibiotics. So normally antibiotics don't affect human cells. So these are going to be the stronger antibiotics, the really strong ones, and they're going to affect the DNA. Lastly, we have radiation or radioactive isotopes. So the isotopes are actually chemicals that are radioactive, and we can infuse it and or insert it in a capsule form. It's going to release radiation and hopefully slow the growth of the cancer. All right, that ends part 2 of the chapter. So next time we got part 4 coming up. We'll just continue on going through the different drug classes and their uses. Once again, thank you for joining us, and don't forget to tell somebody who may benefit from these lectures.